First, identify the patient, determine the need for sanctioning, verify the sanction order into the patient chart if necessary, then explain what you are going to do and the reason to the significant other, even if the patient does not appear to be alert. Then perform hand hygiene. Adjust the bassinet into the comfortable working position. If patient is conscious, place him or her in a semi-Fowler's position. If patient is unconscious, place him or her in a lateral position facing you. Move the bassinet close to your work area and raise to the waist height. Place a towel or a waterproof pad across the patient's chest. Adjust suction to the appropriate pressure. For a wall unit, 60 to 80 mm mercury. For a portable unit, 6 to 8 cm mercury. Put on a disposable clean gloves and occlude the end of the connecting tubing to check the suction pressure. Place the connecting tubing in the convenient location. Open sterile sanction package using aseptic technique. The open wrapper of container becomes sterile filled to hold other supplies. Carefully remove the sterile container, touching only the outside surface. Set it up on the work surface and pour a sterile saline into it. Place a small water-soluble lubricant on the sterile field, taking care to avoid touching the sterile field with the lubricant package. Increase the patient's supplemental oxygen per facility policy or physician's order. Put on a face shield or a goggles mask. Put a sterile gloves. The dominant hand will be manipulate the catheter and must remain sterile. The non-dominant hand is considered clean rather than sterile and will control the suction valve Y port on the catheter. With dominant gloves hand, pick up sterile catheter, pick up the connecting tubing with the non-dominant hand and connect tubing and suction catheter. Moisten the catheter by dripping it into the container of sterile saline. Occlude Y tube to check suction. Apply lubricant to the first 2 to 3 inches of the catheter using the lubricant that was placed on the sterile field. Remove the oxygen delivery device if appropriate. Do not apply suction as the catheter is inserted. Hold the catheter between your thumb and forefinger. For nasopharyngeal suctioning, gently insert catheter through the nares along the floor of the nose ring towards trachea. Roll the catheter between your fingers to help advance it. Advance the catheter approximately to reach the pharynx. For oropharyngeal suctioning, insert catheter through the mouth along the side of the mouth towards the trachea. Advance the catheter to reach the pharynx. Apply suction by intermittently occluding the Y port of the catheter with the thumb of your non-dominant hand and gently rotate the catheter as it is being withdrawn. Do not suction for more than 10 to 15 seconds at a time. Replace the oxygen delivery device using the non-dominant hand. Flush catheter with saline. Assess effectiveness of suctioning and repeat as needed and according to the patient's tolerance. Wrap the suction catheter around your dominant hand between attempts. Allow at least 30 seconds to 1 minute interval if additional suctioning is needed. No more than 3 suction passes should be made per suctioning episode. Alternate the nares unless contraindicated. If repeated suctioning is required, do not force catheter through the nares. Suction the oropharyngeal after suctioning the nasopharyngeal. When suctioning is completed, remove gloves from dominant hand over the coiled catheter, pulling it off inside out. Remove gloves from the non-dominant hand and dispose of gloves, catheters, and container with solution in the appropriate receptacle. Remove face shield or goggle mask and perform hand hygiene. Then turn off the suction, remove supplemental oxygen, place for suctioning. If appropriate, then assist the patient into the comfortable position. Do the oral hygiene for the patient after suctioning. Then reassess the patient respiratory status including the respiratory rate, effort, oxygen saturation, and lung sound. Then document the procedure into the patient's chart.